Good day, Missoula County. Today is Wednesday, June 10th. I'm Ken Parks, Standing Incident Commander for our county's COVID-19 response. This afternoon, I'm going to update you with local and state case counts and discuss asymptomatic and pre-symptomatic spread as it relates to the coronavirus and our public health response. As of this morning, we've had a total of 41 cumulative positive cases to date in Missoula. 39 of those cases were identified by testing, 2 were epi-linked. We've had 40 recoveries and 1 death, and we have no active cases in isolation currently. The state has a total of 561 cases, including 8 new cases confirmed this morning. New cases today are reported in Gallatin and Bighorn counties. The state is reporting 56 active cases across the state. Before I can talk about asymptomatic and pre-symptomatic spread, we need to remember that we've been learning about and responding to the novel coronavirus in real time. While we can lean on our expertise and experience with other coronaviruses, we still need to shift in response to the novelties of this particular type of virus. In general, coronaviruses are a family of viruses that can cause respiratory illnesses in people. Some coronaviruses also circulate among animals, such as cattle, cats, and bats. Just like there are different types of related viruses that cause things like smallpox and chickenpox, different types of coronaviruses create different outcomes. COVID-19 is not an exception. While it is part of a family of known coronaviruses, it has some things in common with other types of coronaviruses. COVID-19 is a new addition to the virus family of 7 types of known human coronaviruses. We know that those 6 other types of coronaviruses can cause colds in both children and adults, with people typically experiencing mild and manageable symptoms. We know that COVID-19, however, the novel coronavirus, can cause mild to very serious respiratory health issues, and that those respiratory issues can compound and exacerbate pre-existing health conditions. In addition to a cough, shortness of breath, or difficulty breathing, which really means someone's having difficulty breathing while going about their regular daily activities, COVID-19 symptoms include fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. Up until this point, we've seen that in general, people with COVID-19 have a cough and a shortness of breath with 2 or more additional symptoms. The novel coronavirus seems to spread easily, and sometimes by folks not experiencing any symptoms. Asymptomatic spread refers to the viral transmission by people who do not have symptoms and will never get symptoms from their infections. In this case, asymptomatic individuals are like carriers of the virus. They can pass it on, but feel unaffected by the virus in their own bodies. Presymptomatic spread refers to viral transmission by people who do not look or feel sick, but will eventually develop symptoms. Just like asymptomatic folks can spread the virus without knowing it, pre-symptomatic individuals can also spread the virus without knowing. The difference is that a pre-symptomatic individual will develop symptoms, and an asymptomatic individual will not. Knowing about different types of viral transmission helps inform our health and safety response. The good news is that individuals and communities can take minimally invasive steps to reduce the chances of asymptomatic or pre-symptomatic spread, thereby increasing safety while reducing the risk of exposure and transmission. This is why public health experts continue promoting wearing cloth face coverings when you cannot maintain 6 feet between you and non-household members. Although that covering is on your face, and yes, it is awkward, and it is an incredibly selfless act that you can do for others that you love, care about, or interact with across the community. Your mask increases the safety of other people by keeping potentially asymptomatic or pre-symptomatic spread at bay behind your cloth face mask. Recently, we've heard what might be confusing information about asymptomatic and pre-symptomatic coronavirus spread. To help dispel some confusion, let's review what we know. What we do know is that the CDC reports that about 40% of all coronavirus transmission, the whole family of coronaviruses, occurs when people do not feel sick. More recent evidence specific to COVID-19 indicates that anywhere from 25 to 45% of infected people do not have symptoms and can transmit the virus to others. We can't tell by looking at someone if they are pre-symptomatic or asymptomatic. The person themselves probably has no idea either. since they're not experiencing any symptoms or noticing anything particularly unusual in their health. The difference is that when we contact trace and look backward in time, we can identify whether or not someone was pre-symptomatic at the time of viral transmission or exposure. Since we can't tell if we are pre-symptomatic or asymptomatic, or if others are pre-symptomatic or asymptomatic, we need to continue practicing those safe behaviors that have likely become routine by now. The cloth face covering, while a minor inconvenience, can really go a long way toward protecting others by reducing the likelihood of asymptomatic or pre-symptomatic viral spread. Remember that COVID-19 is transmitted by droplet spread, meaning that if someone with symptoms or someone without symptoms can spread the virus when speaking, yes, we spit a little when we speak, or they might spread it by touching their face, nose, or mouth, and then touching another surface or person. In short, let's stay the course. It is the best way of safely moving forward together. Wear a face covering when you can't maintain 6 feet of space between you and others. Wash your hands thoroughly and frequently. Cover your cough and sneeze with your elbow. Wipe down and sanitize frequently touched surfaces. It might not be your health that you're helping protect. It might be your loved ones, friends, or community members, or even folks who might have immunocompromised systems who need your help. Let's continue taking care of each other, Missoula, and practicing the kindness along the way. Stay safe, be well, and have a wonderful day. Thank you.